Hi, it's Karen and Helen here from Nurturing Nurses. We just wanted to have a chat to you today about coming into the winter season here in Australia, where we do get lots of viruses and bugs, and your baby is likely to get a cold or a cough where they're quite mucousy and congested.
That's right. Now, unlike us, big people, who we tend to have runny noses and we can actually blow our
Mm.
noses, we know what to do. Babies obviously don't. So they tend to be quite stuffy in their nose, and you'll see some signs with them when they're trying to feed. So whether it's breastfeeding or bottle feeding, babies are predominantly nose breathers,
Mm-hmm.
so they prefer to breathe through their nose than they do through their mouth. So when their nostrils are blocked with mucus, they would find it really, really hard to breathe and hard to feed. So you might actually see that. So what sort of things can we do for them? So there's a lot that you can do at home. You can get some over-the-counter remedies that Karen is going to give you a demonstration on that you may find really useful if your baby's congested. And I'm also going to show you some facial massage that you can do at home as well.
Okay, so one home remedy that you might like to use, which can be very effective, is some saline nasal spray. You can buy saline nasal spray. I don't know whether you can see that there on the video, over the counter at your pharmacy. And with that would also come a nasal aspirator. All right, so you may want to place a roll just under your baby's shoulders, just so that we can extend the head just back a little touch. Obviously not too much, because if it's too much it can block off the airway. So just a little touch, and then taking the lid off. If it's a brand new bottle, you'll need to prime the tube first. So you'll just need to give it a couple of squirts, all right, to prime. And then you will just place the applicator just in the tip of the nostril. You wouldn't push it right back into the nostril, just in the tip, and then you would pull back. One squirt, and then doing the same in the other nostril, you would give another squirt. And then we would leave the baby for 2 minutes and let that nasal saline spray work. It's magic, because what it will do, it will start to thin out all of the mucus in the nasal passages. And then after 2 minutes, we can use the nasal aspirator. So for this, you will need a tissue. So we will squeeze all the air out of the aspirator, place that again just in the tip of the nostril there, and then slowly let go. And that will suck out any mucus. And then we will squirt any mucus just onto the tissue. All right, and then we'll do exactly the same with the other nostril. Squeeze the aspirator bulb, place the little tip just at the tip of the nostril, and slowly release. And that will aspirate any loose mucus from the baby's nose, and then dispel that mucus again onto the tissue. And that should help in clearing some of the baby's mucus. But bear in mind that if the baby has got an active virus, they are going to continue to produce mucus. So you may need to do this before every feed to clear the nostrils, and that will help your baby to feed much better.
Okay, so moving on from Karen's little talk about using the saline spray. Once you've done that, it's quite a good idea to do some facial massage, which again can just help to relieve the nasal congestion. So it's really important before you do this that you give your hands a good wash, because you're going to go right near the eyes. And also make sure that you don't have any long jagged fingernails, again, because you don't want to hurt your baby when you go near their eyes. So with nicely washed hands, keeping your baby in the same position that Karen had there, just on a little neck roll. Using your pinky fingers, you are going to place your fingers in the inside of the eye. And what we're going to do is follow the line of where the nasal congestion comes down the face. So you need to do this with quite moderate pressure. So you should be able to see the skin move. We're coming down past the nose to the edges of the lips and going round to the bottom of the earlobe. And we're going to repeat. Pressure down past the nose, across the top of the lips, and to the base of the ear. Now you need to do this a number of times, around sort of 6 times is probably good. And again, you can do this before each feed, like Karen said, you can combine all this together. And what it actually does is it breaks down the mucus that is here in the face, and you can sometimes actually hear this breaking down as you go. And this will again help to release the mucus that we've just thinned out nicely with the saline spray, and make that release the tension for the baby. So we hope that you've enjoyed this demonstration. And if you have enjoyed this video, we would love it if you would like and subscribe to our YouTube channel. Thank you.